Well, welcome. I'm Dr. Allison. Thank you for coming. I'm so glad you're here. Some of you guys look very familiar, and I've seen you around the clinic, so that's awesome. This is the best thing you can do for your health. So the fact that you are starting now, I'm very passionate about this, but what you do during pregnancy affects you when you're 40, when you're 50, 60. Because if we can learn how to utilize our pelvic floor, learn how to utilize our core, we have much better outcomes in the delivery room. So welcome. Hi. So I teach this to OB nurses, all at local hospitals. I teach this class to many pregnant women. And really, it's my mission just to teach people how to breathe baby out, protect their pelvic floors, learn how to coordinate our pelvic floors in order to have less traumatic births. I know that we can not have a 30% C-section rate. There are times that we need to have C-sections, and they're there for a reason, but they absolutely are overdone. And I think the more that we learn how to connect to our core, learn how to connect to our breath, the easier we'll have as far as delivery goes. You'll have faster recoveries, you'll have less tearing, less vacuum assists, and less C-sections overall. The least amount of interventions we have, the better the recoveries. The less scar tissue we have, the better our cores can just kick back on postpartum. So, I'm glad you're here, investing the time. We're gonna go through some anatomy stuff, so we'll learn about some body changes that you might already be experiencing. Who here is in their first trimester? Awesome, welcome. Second trimester? Okay, third? Awesome, not yet pregnant? That happens too, just to prep. Cool, okay, awesome. Well, welcome, and we'll get started. So, first off, I just have to tell you that it doesn't matter if you've had one pregnancy or 15. Every single pregnancy is different. How our bodies carry is different. But what matters is when you are connected to your body and to your core, it does not have to be, you'll have a better likelihood at being pain-free. And so what I'm going to teach you tonight will help keep you pain-free during pregnancy, but it will also help you in the delivery room. So it's a little bit of a double whammy, because if you are having pain during pregnancy, a lot of the time your pelvic floor is just tighter, and so your core is just not as effective. And so if you are having any SI joint pain, any pubic bone pain, any incontinence already, or urgency, having to go all the time, those are signs of pelvic floor dysfunction. And that would be a time where it's like, you definitely know that you need pelvic floor physical therapy. A lot of the stuff I'm going to talk about tonight will help you on that journey and help you get in touch with your pelvic floor, help you heal some of that dysfunction. But what I'm talking about isn't necessarily what you're going to find at your general pelvic floor physical therapist. We have what we call body motion birth preparation protocols, and they're specific trainings for the pelvic floor so that we can train the pelvic floor to be extensible, soft tissue, so that the uterus can do its job in really helping push baby out, and you don't have to push for hours. Because how many times have you maybe already been in the delivery room and or have friends or you see on TV, like, hold your breath and push? It's super common. Like, that's what we're taught. That's what I was told to do in my first 2 pregnancies, and it created massive amounts of tearing and massive amounts of prolapse. So prolapse is where bladder, rectum, or uterus can descend down into the vaginal canal, and a lot of times it stays with you the rest of your life, or at least some of the symptoms do. At least some of the positioning does, but the symptoms don't have to. So the better that you get connected, the better your results are, that you won't experience that stuff. We have a ton of patients that are OB nurses because they see our clients deliver in the delivery rooms and they want to know what they're doing. And truly, the difference is when you can train your pelvic floor to open, so not close, but train your pelvic floor to open, you will straighten the chute of the vagina, so like where baby comes down and out, and you won't have to push through this like tight and squeezed situation of a vagina / pelvic floor.
It hurts.
Yeah, and it can take a really long time. So let's get started. I'm going to teach you a little bit about the core. This will be interactive, so we're going to do some of the exercises together. But the core itself is your pelvic floor. So this is the bottom of your core. The top is your diaphragm. So the diaphragm sits underneath your rib cage here. Your rib cages might have already started to expand. So you might notice that your bra sizes are already getting bigger. That's totally normal. That is the rib angle expanding. That's your diaphragm straight, like flattening out a little bit. That diaphragm needs to move every time you breathe. So when you breathe into your belly, that diaphragm is descending into the belly. What happens is that the pelvic floor, the bottom of the core, needs to open and descend when you breathe like that. So they move together. So we're gonna do some breath techniques. Actually, let's just start now. Then I'll do some more anatomy. Let's have everyone, you wanna stand up with me?
Yes.
Okay. We'll put a hand on belly, hand on chest. Your goal is to not let the hand on the chest move, but to let the air fill the hand on the belly. So take a really nice deep breath into the belly. What you're feeling is that diaphragm descending as the lungs fully expand. Let the air leave the body. Go ahead and exhale. Okay, we're gonna do that again. You're gonna inhale, fill your lungs completely, pull that air down into belly. Try to really drive it down into belly, soften the belly. Exhale and let it go. Chest isn't moving a whole lot. Good. What needs to happen next is we're going to connect down to our pelvic floors. We're like already getting comfortable with each other. So I want you to think about your vagina. So connect to your vagina or connect to your anus and give it a little squeeze. So if you squeeze it, that's a Kegel, just to bring you a little sensation there. Most people are already semi-contracted and you don't really need to be busting out Kegels during your pregnancy. It's just the opposite of everything we want to train. And so what happens when you breathe in with your diaphragm and you fill those lungs, that vagina and that anus need to open and expand when you inhale. That is natural movement. So that should happen every time you breathe. Most of us have some level of stress, or we were just never connected to our vaginas in our pelvic area. Like we're taught to cross our legs and like close everything off, suck everything up and in. That tightens the pelvic floor. Add on that maybe some trauma, stress, like anger, like whatever it is, the pelvic floor stores that and really just stays tight. So we don't have naturally a ton of movement. Most people don't, unless you're maybe a professional singer and you're very connected to your pelvic floor. It's something that should be taught in like elementary school, like simply how to poop, how to pee. You guys can sit down now. And because like if we're connected to our pelvic floor, then we know how to use it. So we're gonna do that breath technique. I'm gonna stay standing for a minute. I think everybody can see that's online. Okay, so we're gonna put a hand on belly again, hand on chest, connect down to, let's go anus first. Some people have better connection with the anus. I want you to think about inhaling.
I don't know what you mean when you say connect.
Mentally think about like what that muscle. So if you squeeze your pelvic floor or you close your anus like you're holding in a fart, that's a squeeze, that's a Kegel or a pelvic floor contraction. Our goal is to go the opposite way. I'm so glad you clarified. The question was, I don't know what you mean by connect. So connecting just means that you are mentally trying to find that muscle. So some people have a better chance at feeling it when they squeeze it. If you're like, lady, I have no idea what you're talking about, when you go home tonight, if you are comfortable touching your own body, put a finger either right inside the vagina or right at the opening of the vagina, and you can feel. Can you feel the squeeze? Can you feel the relaxation or the opening? So what needs to happen when you inhale, the lungs fill, the diaphragm flattens, the vagina opens, the anus opens, you exhale and let it go. So that's the breath pattern that needs to go through. Let's go through it one more time. So you're gonna deep breath into belly, let the lungs completely fill, try and drive that air into the low belly. As you inhale, that vagina is opening, the anus is opening. So you're imagining if the vagina was a rosebud, you are trying to blossom it to see all the petals of the flower. That's the move. And this can be a hard area to connect to. And if you're like, I really just can't feel it, then just start breathing this way. Just start breathing into your belly. 5 minutes every single day is gonna help train that diaphragm to descend. So when I said like the diaphragm is that top of the core and it's starting to flatten out because your ribs are expanding, it's getting weaker. So as the ribs expand and the diaphragm gets longer, it gets weaker because it loses what we call a length tension relationship. That doesn't really matter, but just know that like it gets weaker. So the way to train it so it gets stronger is by doing this type of breathing. You might be like, how is this even an exercise? But it truly is. Like doing like intentional breathing exercises is completely a very good exercise for the top of the diaphragm. And then it will eventually drive into the pelvic floor. What happens for a lot of our clients and like really what we specialize in is helping open up the pelvic floor, because sometimes breathing isn't enough to get that extensibility. If you think about the pelvic floor has to like really open for a baby's head to come out here. As the cervix dilates, so you have your uterus here, you're contracting, then you get the cervix to dilate, that's why you're getting those contractions. And as it dilates, it also has to descend down into the vagina. But if the pelvic floor is super tight, then you're working against a cement wall. And time again, if I could change the world, this is honestly what I would do, you guys. Every single freaking person who is pregnant would have this type of work done on their pelvic floor to make this like a squishy, soft, nice, hydrated muscle that can totally stretch. This is what we do with our clients, and it makes all the difference, because then you literally can just do that breathing that we just did together, and then you just breathe baby out. And sure, could you tear still? Yeah, maybe the baby catches a fingernail on the way out, but it's like a very small tear. It's not like you're getting these like massive second, third degree tears of the perineum when you train this muscle. It's kind of like this, a really healthy pelvic floor. Let me just PS this, because if you do this before menopause, not that you care about that right now, but like I'm perimenopausal, so like if you do this work now in pregnancy, this sticks with you. Like you get this healthy now, like yeah, sure, you still have to recover postpartum, but it stays with you. And then all of a sudden, like you have this motion of your pelvic floor. And for a healthy core, if you're running marathons, working out at the gym, or even just walking with your babies, like your pelvic floor has to have this extensibility. It has to be able to open and close. It's like a slinky. So every time your foot hits the ground and you're walking, it is the shock absorber. Everyone who has a frozen pelvic floor that doesn't have that movement, it doesn't get that shock absorption, so that goes into the knees, the hips, the SI joint. And so you end up with women with years and years of pain, cortisone injections, joint replacements, because they've worn out their joints, because they don't have that natural shock absorption or natural core control. Because, go ahead.
Is the pelvic floor the whole thing that you're holding up, or is it just like the soft tissue?
The pelvic floor muscles are the soft tissue.
So it goes from like the vagina to the anus?
Yeah, it's a bowl.
Okay,
yeah.
Sorry, I just wanted to be
perfect.
clear.
No, let's go.
Sorry to interrupt you.
I love it. I got a little carried away. I get very passionate about it. But this is the pelvic floor.
Okay.
It also contains like your skin, your nerves, blood vessels.
Okay, but it's not the bone.
Your lymph. No, these are your pelvic bones.
Okay.
It sits within that.
Okay.
The bones loosen up during pregnancy, and because of relaxin and progesterone. So, have you guys heard of relaxin? Okay, relaxin is that muscle or that hormone. It can be like full blown at 6 weeks. So even if you like have a miscarriage later on, you still have all the effects of relaxin in your body. So it still like is very much like you have to recover from that, because relaxin is very potent in how it makes our joints flexible. And for good reason, like we need it to happen. It's not just specific to the pelvic joints, it happens in the entire body. It makes everything more flexible. So you are a little bit more predisposed to injury when you are pregnant, just because of the joint flexibility. So just keep that in mind if you're trying to like ski this season and whatnot, or do some kind of contact sport. That's why they don't always recommend it. But this joint, the pubic symphysis, it spreads 6 to 9 millimeters during pregnancy. Well, 6 to 7 millimeters during pregnancy, but up to 9 during the actual delivery itself. Sometimes people get pain in this joint. It's called pubic symphysis pain. And there's a lot you can do for pubic symphysis pain, but if you are getting pubic symphysis pain, then that means that your pelvic floor is in a literal spasm, contraction, trying to hold that joint together. So all the more reason to learn how to open the pelvic floor, get the extensibility within this pelvic floor. Does that answer that question?
Yeah, sorry, I just wanted to be clear on what the pelvic
Yeah.
floor was.
No, that's
So,
really a good question.
Before like you moved on, cause I wasn't sure.
Yeah.
I know that's like probably everybody here knows, but I
No,
wasn't
no,
sure.
it's so good. The anus is inside the pelvic floor,
Okay.
so all pooping, farting, all that stuff. The vagina is inside the pelvic floor. The clitoris is inside the pelvic floor. The urethra is inside the pelvic floor. So everything with like urination in the urethra, anything with like intercourse inside the vagina, anything with bowel movements, farting,
So the
leaking
bladder
gas.
is too, or no?
Yeah,
Oh, the
yeah.
bladder's part of it, and
They're the organs that are on top of the pelvic
Okay.
floor. Yeah.
okay.
So that's why this is like so important.
Yeah.
Because it affects every single hole, and there's a different doctor for every single one of these holes. So no one really ever like puts together how important like treating the actual pelvic floor
Yeah.
is, because you literally have a colorectal doctor, an OBGYN, a urogynecologist, like you have every separate doctor. And so maybe that's a conversation for another day. But regardless, so that's what the pelvic floor is. So you want to protect its functions, because if you do have a tear postpartum and that is affecting you being able to hold your poop in or being able to hold your pee in, or even just have an orgasm. A lot of people struggle to have orgasms after they deliver. And it's like, it's because the pelvic floor is affected. So the more you get this conditioned before delivery, the better. And like the number one thing, like it's that simple what I just told you, and we're gonna do it again a few other ways, but it's that simple. It's like just breathe. If you breathe using that diaphragmatic breath with the pelvic floor opening, if you can figure out how to coordinate that, then you'll be golden. And also, you might not have the opening and flexibility that you need, and that's why you can definitely come see us at the clinic, so at Body Motion. But just at least start with the breathing, and that will help. Questions? Yeah.
This might be jumping ahead.
No, go
When
ahead.
you're having a contraction then,
Yeah.
are you supposed to do this breathing like whether you're in contraction or not?
Yeah.
Or is it so then there's no coaching around push because you're just breathing normally through the entire delivery.
Yeah, I'm gonna repeat the question. So you're asking like when you're having contractions or not having contractions, but if you're in active labor, should I breathe like this? 100%. And let me tell you why.
And so there's no difference then, because usually it's like, oh, now you get a break because
Yeah.
you're not contracting, and now you push, but that's not.
Yeah, so what we train you to do, like, so when people come to Body Motion for birth preparation, it's a lot of internal manual therapy. So it's literally a finger inside the vagina, opening up these pelvic floor muscles, creating new motion. And that might sound scary, but that actually makes the muscle so much stronger, because the more stretch it has, it's called eccentric strength. The more stretch it can get, the better contraction it can get, first off. So it actually makes sex way better.
I heard.
Yeah.
No, go ahead. I just heard of people like their husbands doing that for them, like to prep for birth.
Yeah,
I
so
don't know if it's like, but it's probably like they're not physicians, so.
yeah, there's something called perineal stretching, and we can talk about that.
Oh, okay.
This is different because we're getting all 3 layers of the
Yeah.
pelvic floor, and that's really where the important like
Yeah.
stretching needs to happen.
Sorry.
No, you're good. You're good.
Eccentric stretch.
Oh, eccentric strength. So what happens is if we can get that opening and that strength, you are just that much more strong. So a tightened pelvic floor is not a good, healthy pelvic floor. That actually usually means like sex is worse. That actually means that that's when you pee your pants. Like most people are like, no, I need to tighten it. I need to do Kegels. And that's not the case at all. Usually a tightened pelvic floor is putting a ton of pressure on the pelvic organs themselves, like the bladder. And so it's literally squeezing the pee out. And then a tightened pelvic floor turns to, this is a food analogy, so and meat, so cover your ears if you can't tolerate a meat analogy, but the pelvic floor is a muscle, right? So we want it to be a healthy muscle, which is like a juicy chicken breast. If we have a muscle that's like dehydrated, it's more like beef jerky. So it's more predisposition to tear, and we don't want that type of muscle. So the healthier we get, we want the pelvic floor to be the chicken breast. And how you get that is by doing this type of stretching and this type of extensibility work. And then we train that with the breath. And we train it in multiple positions depending on where you have the best control. So you can determine the best position for you to labor in and the best position for you to deliver in. That was a little side note. But let's go back to the core. So the core itself, I'm going to teach you guys another exercise. This will help prevent diastasis, so that ab separation. Has everybody heard of a diastasis recti? Okay, that's where you might feel like you have a hole in your belly, or when you do like a sit-up, that you get a little bit of coning. At this stage in the game, I really recommend that you don't really do a lot of sit-up work, and even getting out of bed. When you get out of bed in the morning or at night, like roll to your side and then push yourself up. You want to avoid that like crunching. But I will tell you, like, the most times I see people give themselves a diastasis and like know they feel like, oh, I just did that, is when they sit on their couch. So sitting on the couch at night is very hard on the abdomen, not just at night, like anytime. So when you go to sit on your couch, just use your hands. Like, use your hands to really lower yourself slow, and then use your hands, like, you get the couch, right? Pretend. And recline back. What happens is a lot of people just, like, recline back, and then you're like, oh, I just busted it open. And so you want to use your arms as you recline back. Same thing coming forward. You want to use your arms. The other thing you can do is use your breath. So when you are doing anything with exertion, you're exhaling the air. So if you're reclining, you're shh. If you're leaning forward, you're shh, but using your arms. That's going to help just pull things in a little tighter. Activating the transverse abdominis muscle. Do you guys know what this muscle is? Heard of it? Yeah. Okay. Let's stand up and do it together. So this is the muscle that if you can activate this will help prevent that diastasis, or at least keep it at bay if you already have one. So it's right inside your transverse abdominis muscle, is right inside your hip bones here. And you can kind of put your hands there, and you should feel, like if my belly's totally relaxed, you should feel when you engage that muscle, that the muscle comes in and up towards your head to get some activation there. And that's contracting the muscle. So you're not like full on bracing your belly, you're not flattening your back, you're not doing any of that. Your spine should be totally neutral, like nothing should move. And all you're doing is pulling that lower belly up and in and holding that for 10 seconds. 10 seconds, 10 times, once a day. That's all. Golden. It's really that simple. Yeah.
Can you show that here? So
Yes. Yeah.
Okay.
So if you're here and belly is totally relaxed, and I'm just pulling up and in, like I'm giving baby a hug. And just like activating those little muscles, let it go. Pull baby up and in. And you try to keep your butt cheeks totally relaxed as you do it. If you get really good at this, you also want to try to keep your pelvic floor relaxed as you do this. If you can keep your pelvic floor open, that will help prevent the pelvic floor from tightening and contracting more.
What was the name of the muscle again?
Transverse abdominis muscle. So we also have a whole online birth prep program. I think someone's winning it tonight. And I go through a lot of these specific exercises that are preventative in that program too. So let's go back to, let's now sit down, but don't sit down together, like don't wait 1 second. So one way to help keep the pelvic floor more open during pregnancy, as your pelvis is like getting more loosey-goosey, is to sit down on your actual sit bones. So much of the time we sit in like this like rounded posture, but that puts so much stress on the pelvic floor and just causes like more tightness through the pelvic floor. So what I like to say, I'm going to turn this way and then I'll turn the other way, is when you go to sit down, it's a little awkward. You don't necessarily have to do it in public. but you can, is you stick your booty all the way back, and then you lift your butt cheeks up if you can reach, and then you sit down right on your sit bones. And then you can stick some pillows behind your back to like make sure that you're fully supported. You shouldn't have to feel, I'm flashing the camera. You shouldn't have to feel like you're fully like holding your posture up. And that's where if you use support behind your back, that will help keep your spine nice and aligned, and that will help prevent you from like going into this slouch. Does that make sense? Okay, so try it now. I'll turn this
Sorry
way.
for the person behind me.
No one cares. We all do it. And do this postpartum. Like, this is important, not just now, but postpartum. Like, you want to be sitting on your sit bones. It will unload your pelvic floor. So same thing. So lift the booty up, and you have to kind of train it, because like when you're pregnant, like it's hard to get lift because your glutes are usually like so tight from trying to squeeze the pelvis and keep the pelvis together. So we want to prevent that too. So we want to loosen up the glutes. Everything that's attached to the pelvis, just think it needs to be chicken breast muscles. Like it has to be soft, it has to be extensible, and that's what we work on in clinic. It's just like everything that's attached to the pelvis, we balance it so the pelvis can open symmetrically during the labor and delivery, and then we want everything to be able to stretch, because the more it can stretch, the more it can come back together without a ton of damage and intervention.
Yeah.
Makes sense? Yeah.
No, that totally makes sense.
Yeah.
But just, I assume then that like lower back, hip pain, et cetera, is all interconnected as well. So it
100%.
happens,
Yeah.
Okay.
If you have low back pain, if you have, what else did you say?
But yeah, like hip pain.
Hip pain, it's in the pelvis.
Yeah.
So that, if you have any of that going on, the body's natural compensation for that is to just tighten everything up.
Yeah.
And like
Harley's
try to
right here.
hold it together. Yeah. So definitely come see us. Have a consultation with me so we can like get to know like what else in your body is tight, and like you probably, like every single person would benefit from getting pelvic floor work done. So to say that like you need it would be, I think everyone should have it because it changes the game for delivery. But if you have pain, like all the more reason to have it.
Certainly.
Have it done. Okay, so this is the glute glide just one more time. I call it the glute glide. So you lift butt cheeks up, you reach them back and sit down.
I can definitely feel like me
It's
sitting on my bones.
Yeah. And so now when we're in this position, now try to do a nice deep abdominal breath. So let's connect down. You can put a hand on chest, hand on belly. I want you to connect to pelvic floor so you feel, why don't you feel vagina, not physically, just mentally. Get there. And then you're going to take a nice deep breath into belly, filling the lungs, allowing the air to go in deep into the belly, keeping the chest nice and relaxed, opening vagina, exhaling, letting everything go. When you exhale, you will feel a recoil of the vagina and pelvic floor. And when you inhale, you'll feel an opening. It's just mirroring exactly what the diaphragm is doing. Again, don't feel bad if you don't feel this. It is a challenging thing to get, just because of the fact that like we hold like everything up and in. And it's a hard area to connect to, and that's why our birth outcomes are shit, to be honest. Like, it's because like we don't have this type of training, we don't get this kind of pelvic floor coordination down. But yes, let's go into questions right now. Those were great questions. Yeah,
I just find it's easier to connect when I'm standing up. Like I can't feel as much as sitting down,
so
but I
good.
can like feel it when I'm standing up.
So that means that you're delivering standing up. Like,
Oh.
I mean, we'll check you obviously, like, you know, like, and figure out like your best positions. Like that's definitely what we'll do in clinic. Like once you're 32, 36 weeks pending. But we'll figure out like where you have the best opening. And if you feel it the most in standing, you probably have the best opening in standing. So it's probably advantageous for you to advocate or have like your partner advocate for you. Like I need to be delivering in standing, or I need to be at least laboring in standing. Now that will change if you decide to get an epidural. Like if you know
That's
you're
what I
like,
was gonna ask.
yeah, if you're like, I'm gonna get an epidural, in the birth prep program we have a whole slew of like safe positions. We might even have that on YouTube.
Because this is all like stuff for non-epidural births, right?
No, this is epidural or non-epidural.
Oh, because when she was asking about like knowing when to push, I always felt like when I had my kids with epidural, then it was like I had to be told when to push, but when I had natural, I knew when to push.
Yeah, no, you have what's called, the epidural doesn't change,
The
your,
pelvic. Okay.
the pressure, so
Okay.
you'll feel the pressure.
Okay.
It's more so just not having that connection.
Okay.
So,
I just
yeah,
don't really remember so much, like,
Yeah.
it was like my first child, so.
yeah.
But I was just wondering about like, yeah, like if this stuff was, if you can do it during an epidural.
100%.
Okay.
It makes, and like that's like when you were asking, should I do this during the entire labor? Absolutely.
Okay.
Because if you can stay locked in during your entire labor, and like whether you have an epidural or not, but you're doing this breathing, you're doing it during the contractions and not during the contractions. Because it's easy to get not easy. Epidurals can be work or they cannot work, first off. And but like if you get the epidural and you're like, I get relief, you're like, oh, I can like check my phone and like do this, do that. But like if you can stay locked in on your breath and just taste true, it will help the progression of the delivery that much better. So it's just like that mental focus and clarity, because the diaphragm is if you can train your breath, and if you guys all felt your bellies get a little bigger when you breathe, when you inhaled, then when you are going through the delivery process and you are in labor, so even if you're just getting Braxton Hicks contractions, it's a great time to practice. This breath will never put you into labor, but it will help facilitate your labor because the diaphragm with every inhale is descending down into the belly. And when it descends down into the belly, so when you inhale, lungs are full and it's descending, it's pushing down on the top of the uterus. And so as it pushes down on the top of the uterus, it's just amplifying like the effectiveness of that contraction. Mm-hmm. So you're using your diaphragm to help bring baby down.
Okay.
But if you're bracing the contractions and you're not breathing or you're holding your breath,
Yeah, that's what I did with my.
yeah, they become way more painful because you're not breathing. When you're breathing, you get what's called vagal stimulation. So you get more of that like parasympathetic, relax, rest and digest state of being in your nervous system, which is what we want. Because if a tiger was chasing you or you're super freaking stressed, like you are not gonna have a baby, you know, but that's like olden day stress. Nowadays stress, that's like hospital bright lights, that's people that you don't want in your delivery room,
Yeah.
that's someone saying something that didn't sit right with you. And so just like controlling your environment to whatever you can. If you're deciding you want to be in a hospital, then it's like, okay, I know that like I don't want this person in my room, or I'm gonna pretend like I'm at a spa. So a lot of like during our birth preparation training, when we are training you, we mentally go to like those happy places. Like where do you want to pretend you are, even if you're not there? And it's like, so if you're in a hospital and you don't like hospitals, like still just mentally be at the spa or like wherever you want to be, just so your body can be in that relaxed state. And giving yourself that ability to be locked in on your breath is very effective to help regulate your nervous system and keep you in that rest and digest phase. Because like what you'll see is like maybe someone will be laboring at home and then they have to drive to the hospital and all of a sudden they regressed and like a midwife maybe checked them at home, and then now they're like a lot less dilated because the car ride was stressful. So it's like just managing that stress and knowing that you just need that like you need to use your diaphragm to keep you in as relaxed of a state as possible. And so that's the double whammy, but it's also helping move baby down with each contraction that the uterus has. And as the uterus is contracting, it's just simply working to open the cervix.
So you can wait. So I just was wondering. You made me think of a question to ask. Can you be like at an 8 and then go back to a 7?
Mhm.
I had no clue. I didn't know that. I didn't know
Yeah.
you could go backwards.
Mm-hmm. Yeah.
So thanks for telling us
Yeah.
that.
Yeah.
Yeah.
Happened to me on my third.
And
you
so
know?
that happens because you're tight, or
Usually
or you get
it's
stressed?
like a stress response.
Okay.
Like body's like, oh, okay, not ready, not safe to have a baby anymore.
Oh,
Yeah.
okay.
So
okay.
it's like,
Interesting.
and everyone has a different stress response.
Yeah.
But yeah. So, any other questions come up as we talk through that? Cool. Okay, so I think final thing that we should definitely go over before we talk about how to actually, we've really talked about how to breathe baby down. That's the breath pattern that we've gone through. And we'll talk about pushing in just a minute. But as far as, we're gonna talk about bowel movements. So bowel movements happen through the anus, which is the backside of the pelvic floor. A lot of people have a lot of tension around the backside of the pelvic floor. The first thing that you should start doing is be aware of your body, whether you're doing dishes or laundry, when you're at home, standing for an elevator, whatever it is, check in with your butt. Like, are you clenching your butt? Are you squeezing your butt tight? If you're squeezing your butt tight, you're squeezing your pelvic floor tight. So the first thing you gotta retrain is to not squeeze butt tight. Like, keep everything open, keep your glutes relaxed. Try to keep your glutes relaxed and use your lower abs to support your body and not your butt cheeks. Your butt cheeks are gonna be really squeezing that pelvic floor. So, pooping. The best thing to do with poop is the minute you get the urge to poop, you wanna go. Try to go within 15 minutes, and that's really important. If you're having constipation during pregnancy, talk to your provider about taking magnesium or taking something to help regulate that constipation. The more constipation you have, the more poop that you get that is stuck in your body, the more pressure that's just sitting on the bladder. And we don't want that. You already got a baby growing on your bladder, you do not need more poop pressure. So get that poop out as much as you can. Every time you have a bowel movement from here on to delivery, imagine like you were having a vaginal delivery, like baby is coming through birth canal. It's just the poop, but imagine that it's baby, because it's the same exact sensation. So if you practice this every single bowel movement until delivery, your brain is like, oh, I know that pattern. I know that this feels fine. I know that this is normal, this is safe, it's okay. But when we go into delivery and we're like, wait, is that what it's supposed to feel like? Baby's coming through, I've never felt that sensation. Sorry, just pro tip, that's another reason why to do pelvic work during pregnancy. It's just so you know what that feeling is. It's so important. And it takes someone skilled to do that. I don't know of a husband that can do that very well. But we teach husbands all the time. They come in to appointments all the time.
Oh, that's great.
But I would say off the bat, they're more like, what? And especially because it's not always comfortable, to be honest with you. And so then you're like, what are you doing? Like, you know, and so that might not feel safe for you. Where's it going from? Oh, pooping. Okay, so pooping is synonymous with breathing baby out. And so when we sit on the toilet, totally did not wear a good outfit for this. When you sit on the toilet, ideally you want to be knees apart and like this. You can use a squatty potty to get your feet up. That might not feel good with a belly, depending on how big baby is or how you're carrying. And so then you would want to maybe lean forward without the squatty potty. If this doesn't feel good on your body though, then it's not for you. So what this does is it helps straighten the chute for the poop to get out. This is true for poop though, but not for baby, okay? So when you lean forward, it just straightens what's called the anorectal angle so the poop can get out. This is true if you're pregnant or not, so teach your kids to poop like this if you already have kids. This will help prevent constipation and things like that. So when you're in this position, and this feels okay on your body. If it doesn't and you're having back pain or something hurts, that just means pelvic floor is tightening, so don't poop in that position. If it feels better to go this way, then go that way. So knees are apart. I'm not gonna spread any further, but just pretend. And then when you're on the toilet and you've gotten the urge already to poop, you're gonna do 3 belly breaths. This is not just during pregnancy, this is the rest of your life. 3 belly breaths, so you're on the toilet, you're going, inhale just like we did, think about opening, exhale and letting go, because when you're doing this type of breathing, yes, we're pushing down on uterus, but we're stimulating the colon, like we're stimulating peristalsis, so it's really helpful to move the poop along without having to push, because if you're pushing the poop along, you're going to be more apt to like pop a fissure, an anal fissure, which is like a cut on the anus, or a hemorrhoid. Hemorrhoids are super common during pregnancy. So we want to prevent that as much as possible, and or if you have a hemorrhoid, not make it worse. So this is how you do that, is by not pushing the poop out, by breathing the poop out. So we're here, we're breathing poop out, we're inhaling, 3 breaths, exhale. At the top of the 3rd breath, I'm going to inhale, and then I'm going to gently bear down, like I'm trying to fart, but it's not like I'm not pushing, it's just a fart, like I'm trying to like flare my anus, but I don't want anyone to see me fart. So it's like a really gentle fart. You might feel the front of your belly contract a little bit, but the goal is to open, with the belly, open with the breath, so the diaphragm's all the way down, you're thinking about opening the anus, and then if you have to at the top of the third inhale, that's where you just gently bear down. Like you're trying to fart, but you shouldn't see it in my body, you shouldn't see it. Like it's a very gentle fart. Does that make sense? Okay. Cool. That's how you poop. And now to take it a step further though, every time that you do that during this pregnancy, just imagine baby coming through, because you're mental mapping this for your brain. You're literally telling your brain, okay, that's what it's gonna feel like, and then start to visualize it. Be like, my baby's head has this hair, and like this is what it looks like, and I'm breathing baby out, and like feel it come out. Like, yes, you're just pooping, but like it's a game changer when the more time you spend visualizing, the better it will be, because your brain is just gonna have that map. It's gonna know like, okay, this is what it feels like, and you're gonna go from there. Make sense? Cool. You guys all are getting a copy of the book, I believe, right? And so this is lined in the book. So like you will see it in the book. You can read through this. I have a meditation in the book that you can just simply read through, and it guides you. It just says like, okay, now I'm breathing. Now like here's what my pelvic floor is doing, and just put it on repeat. It's also on a podcast. Like we have it on multiple venues that you can just put it on repeat and just do that type of breathing. And again, if you're not feeling it, you have pain, anything like that, you should obviously like just come and get checked and do some birth prep, because that will help recovery. But if that's not possible, definitely at least do this breathing and like learn how to coordinate it. Okay, let's go into the final, we're gonna push baby out. So there's a couple things. So you can go, some people don't want to be checked during during their delivery. Like they don't want their cervix checked. So they don't want to know that they're 9 centimeters or 10 centimeters or how effaced they are, which means just how thin the cervix is. So for those people that are going to more listen to their bodies, what we usually say is when you get like the deepest urge to poop and you can't hold it in, that's probably when baby's coming through.
Yeah.
And also, if you have an epidural, you can still tune in to feel that sensation as well. And so even if you are 10 centimeters dilated and fully effaced, if you don't have the urge to have that massive bowel movement, then you're probably also not ready to push. Like baby might just not be low enough. And sometimes that happens because pelvic floor is so constricted that baby just can't get down. And so maybe you are going to spend hours pushing to try and get baby through that pelvic floor, or you feel like baby's coming down, then going back up, down, up, down, up. That can happen with a really tight third layer of the pelvic floor. All the more reason to condition that third layer to get all the pelvic floor muscles like totally open. But that's what I would say. Like if you want to tune into your body more so than just be like, oh, I'm 10 centimeters, I'm ready to push. Because you're going to be over it. Like you're not going to want to do it. And that's also a great sign. That like means you're very close. But like you'll be so over it, but you just want to wait for that urge to push, or that urge to have that like intense bowel movement that you can't hold in. Because if you can get to that point, then using your breath is simply just going to slide baby out. And you're not going to have to do the hold. Okay? So you're going to simply just follow the cues we just did. Inhale and open. Exhale. As you exhale, you actually try to stay open. Keep the pelvic floor open. This is in the birth prep meditation that you guys can get online. It's open access. And so you inhale, pelvic floor opens. As you exhale, you try to keep your pelvic floor open, because as baby's coming through birth canal, we want to try to maintain that. So I do suggest that you train that as well, even though we didn't talk about that too much in the beginning. So you're training keeping pelvic floor open as you're training this breath and training throughout your pregnancy. Say that's not working. And this is the problem I run into when I teach the nurses, the OB nurses, because they're like, I don't have time for someone to like condition their pelvic floor to breathe baby out. Because if you haven't trained your pelvic floor to do this motion, it's very, very hard to learn how to do it during the birth itself. So that's why it's like all the more reason to put in the time now. So what I tell them is at least teach them how to breathe, because that will at least help them manage their contractions And if they're breathing to manage their contractions, then they're at least getting some kind of help and assistance from that diaphragm to push baby down. If we have to push baby out because we're just the breathing isn't doing it, or baby hasn't descended to get to that bowel movement place, like where we feel like we have to have that intense bowel movement, then what we say is you want to do open glottis pushing. This is also in the book and you can read about it. But what it means is that as you inhale, I'm going to stand up so I can like not cross my legs. Okay, so because I'm pretending I'm having a baby. You can't cross your legs when you have a baby. All the more reason not to have pubic bone pain, because if you can't spread your legs apart, it's really hard for baby to get through birth canal. FYI. But so you're going to push. Now we're doing volitional pushing. You have to push because baby's not descending as you're breathing. So we're gonna deep breath in. And at the top of the inhale, you're gonna make your belly really hard. You're gonna leave your glottis open, so there's no breath holding. So we're not gonna hold our breath and push down. We're gonna keep our throat open. So at the top of the inhale, we're gonna inhale, throat stays open, and then we just bear down. So we try to push the poop out, push the baby out, but we're not holding our breath. So increased risk of tearing with glottis closed breathing. There is a little bit of research that says it might go faster with glottis closed breathing, but the damage is not worth that.
Wow, it's amazing how it's all connected.
Yeah. So if you guys do this, right now we'll do this together. I'm so hot. That ear didn't kick on. I hope you guys are okay.
Can you lift the
No, it's okay. It's too loud. They couldn't hear on the YouTube. So, it's okay. What's it called? The moves. Okay. So a couple ways to get connected to learn how your throat connects to the pelvic floor. If you talk in a super high-pitched voice, and do this on the way home, like hit a note, like sing a song, and see if you can feel your pelvic floor contract. Like it comes up as you talk in
Mariah Carey.
Yeah. I would love to be her pelvic floor physical therapist. So talk in a super high-pitched voice, you'll get narrowing of your vocal cords here, and your pelvic floor just follows that path of your vocal cords. So if you do a deep voice, like a and again, we do this in our clinic all the time, so people are used to hearing me say this, and I'm totally immune to it, but you can do it with me if you want. And what you can do at home is you can literally put a finger right outside the vagina or right inside and see like what sound works best for me. Like, okay. Am I a moo? Am I a grr? And you can just play with it. Like, do I feel when I moo? Do I feel a really expansive opening? For me, that works every time.
Okay.
But for someone else, that might not. So you got to find out like what connects with you. Is it a grr? Like, does that help you open your pelvic floor? So play with a deep opening sound. Even on the way home, hit like a super dude low voice and see if you can feel that opening. And then hit the high pitch and see if you can feel that opening. The idea here, you guys, is just like getting your brain mentally connected to your pelvic floor. Learning the control will help you. So then if you have to push and you at least know, okay, I'm gonna inhale, open, and at the top of the inhale, I'm gonna move. Okay, I can at least be breathing. That's my open glottis,
okay.
And it'll bear down.
Okay, so the sound is like to know you're not closing up, but also to keep you.
To keep it open, yeah.
Okay.
So it's a great way to get that bearing down without breath holding. Questions?
Okay.
It's a lot. Does that kind of make sense?
Mm-hmm.
Okay. Again, it's all in the book. You guys will have it. I have birth stories in there, and they're so fun to read because you get to find out what's possible, really. Whether it's like a first-time mom having a vaginal delivery, 0 tears, 10 seconds of breathing baby out, versus we've had patients that had such traumatic births the first time and even went to pelvic floor PT, unfortunately. And that's where it's like, so just so you guys know, this is totally separate than pelvic floor PT. So even if you're going to pelvic floor PT, if you want to come here for our birth prep, it will be completely different than what you're experiencing at pelvic floor physical therapy. and we don't work with insurance, so it's completely out of network. But you would do a package of visits to prepare your pelvic floor if you decide that you want to work with us. And
It's
it
the
will,
best investment you'll ever make.
thank
I'll
you,
tell you that.
thank you.
It's truly been transformative for me.
Oh, thank you, yeah.
Huge.
Yeah, it's awesome. It just is. I mean, you forget the magic, and then I like come into an email. There's also this other podcast that we did with Cynthia. So Cynthia was a client of ours, and still is, and she had this traumatic birth and didn't want to have a second kid. Now they're talking about having a third kid, and I'm like, what? But like, she had severe tearing, like some of the worst I've ever seen, to be honest with you. And so did her recovery postpartum, and they were like, you can't have a vaginal delivery, like you should not, you're gonna have a C-section. She was like, no, I think I'm gonna have a vaginal delivery, like we did all this work, like it works now, like everything works. And they like up until her delivery, they were scaring her, like, nope, you gotta choose a C-section. She's like, we're gonna do a vaginal delivery, and like end of story, just super empowered. And she ends up going into labor, doing the breathing, and baby just comes out at home. Like doesn't even have time to get to the hospital, zero tearing, like incredible story. And that's the power of just like knowing how to use your breath to breathe baby out. And having that healthy tissue makes all the difference in the world. And like, it's hard to think about your future self now, especially when you're just trying to survive pregnancy or you're trying to survive all your other kids. But like, when you get to the other side of it, in your 50, 55, you're like, you wish you could have done everything in your power, to have done that. Like, and that's what we just hear. I put it on social media today because I heard it again. And it's like, why didn't I hear about you when I was pregnant? And it's like, okay, I epically failed at marketing it. But also, like, we just know so much better now, like so much better. So I'm really impressed that all of you are here and like committed to your health, because this is what will change the game. And like, tell all your friends, just like send them the replay, whatever. Like, tell your friends to breathe like this, do this type of work. It will change their recovery postpartum. It will change the amount of stitches they get. It will change the amount of pushing they do. It'll change them needing forceps, vacuums, you name it. And like, it might not seem like a big deal because all you maybe want is a vaginal delivery, or maybe you have a C-section. And even if you end up with a C-section, our clients that have had C-sections, whether baby's breech, but they've done all the birth prep work, the surgeons don't have to yank baby out. They say that they just have all the room in the world to just slide baby out. So it's like better C-section recoveries too. And it's just because what you're doing is you're making these muscles healthy. You're giving them blood flow. You're teaching them how to move and open before they go through the trauma. Like, it's gonna be trauma regardless, but, and that's where it's like, be prepared. But
Can you tear even after you've had like births that you haven't torn and like you've had totally fast births before?
yeah.
You can still tear later? Oh,
Yeah.
okay.
Yeah, it's possible. And like, you can do everything in the world not to tear and still tear, like
Okay.
if a baby catches a fingernail. Like,
Yeah, yeah.
it's like, it depends. Baby
Because
can
I never
come
had
out.
the fear of tearing before, but
Yeah,
I guess
and
it's real.
that's good. You shouldn't, because
Yeah.
like, there's a lot you can do to heal it.
Uh-huh.
But the more you prepare, the better. And if you do, like, if your muscle is healthy and not beef jerky, that tear heals so fast.
Yeah.
Like, so fast. So that's a good thing.
Yeah.
So, yeah. It's like an athlete, an NFL player who tears their hamstring. Like, they're gonna be back on the field in like 4 weeks. But if my dad tore his hamstring, like, he's probably not gonna walk for a year. Like, he might need surgery to reattach that hamstring. It's the same
Okay.
concept. You just want the healthy tissue as much as possible.
Got it.
Yeah. Cool. Well, thank you for being here.
Thank you.
One second, I'm counting. Are there 11 or 10?
I don't know.
10 gals.
10. Are you?
Well, I hope you don't pick 11.
Okay. If I do, I'll cancel it. Number 5.
Sweet. So 1, 2, 3, 4, 5. Lindsay.
Yay. Okay, so you get the online birth prep program. Yeah. And then if you guys are interested, we're pretty booked right now, but I did open a couple consult spots. So if you scan, there's a QR code, and if you want to come into the clinic and do a consult with me, you are absolutely welcome to.
Oh, yeah.
It might, is it on that?
Is this it?
Yeah, it must be.
Okay, I was here. I'm gonna
next to
take
the
it.
refreshments too.
Okay, yeah. And so you can sign up for a consult on there. And yeah, happy to chat with you about your goals for birth and beyond. So,
Great.
Yeah.
Thank you.
Yeah, thanks for being here.
When you feel your baby's